Welcome everyone to Parenting as a Physician. It takes a lot of patience from the American Medical Association and the Steps Forward team. My name is Jody Abbott, and I'm going to be first introducing our panelists, and then I'll be introducing myself. So first on the list, we have Dr. Angela Chowdhury. She's an associate professor in the Department of OBGYN at Northwestern and is a MIGS-trained, minimally invasive gynecologic surgeon, and currently the chief of GYN at Northwestern. Dr. Jill Jin is a practicing internist and clinical assistant professor of medicine at the Northwestern University Feinberg School of Medicine. She's a senior physician advisor for patient satisfaction and practice sustainability at the American Medical Association, associate editor for JAMA. She also completed her medical and MPH training at Northwestern. And Dr. Kevin Hopkins has been a staff physician in the Department of Family Medicine at the Cleveland Clinic since 2005. Dr. Hopkins also serves as primary care medical director for the Cleveland Clinic Community Care. I'm going to let each of us talk about our parenting. I work at the AMA as the medical director for the EdHub, our education center. And I'm a maternal fetal medicine specialist at Boston University School of Medicine and Boston Medical Center, where I've been specializing in reducing health inequities. So first, we're going to go in the order of people's kids. So we're going to start with you, Dr. Jin. If you could introduce yourself and your family, and tell us a little bit about yourself and parenting as a physician.
Yeah, of course. Thank you, Jody. Welcome, everyone. Thank you for joining. So as Jody mentioned, I am a general internist at Northwestern, and I also work part-time for the AMA. I have two children. They are 4 and 6, just turned 4 and just turned 6. And at the beginning of the pandemic, they were actually not yet 2 and not yet 4. So they were ages 1 and 3. And of course, I have learned a lot from my experience parenting through COVID and the pandemic. But I will say, actually, that I think the most challenging time for me as a physician parent, and especially as a physician mom, was prior to COVID. So it was when my kids were from 0 to 2, I would say. So I think that while COVID certainly exacerbated many of the challenges and inequities that physician parents have to face, it wasn't the sole cause of it. And many of the lessons that I learned, I actually were the things I learned about how to speak up for myself and things like that, I learned prior to COVID. And it was COVID that brought many of these issues to light on an organizational level. But I think that, again, these challenges were universally faced, even by non-physician parents prior to that. So, you know, this is a very informal webinar. We're going to leave most of the time for specific questions and Q&A, but just a few brief points I'll make right now. So as I said, in terms of the challenges, a lot of it with having very young children and as an early career physician, I would say the main one was the flexibility or the lack thereof in scheduling. So with having young children, there's always unexpected illness. Again, even prior to COVID, lots of days where you get a call that you have to pick up your kid early, or that your kid wakes up with a fever and can't go to daycare. That is not very easy to deal with as a physician with a very fixed schedule. So that was a huge challenge. The other one was, just the work hours in general. And I did cut down to part-time after I had kids when they were very young. So again, prior to COVID, I made the choice to cut down my clinical hours, which was not easy from both my end as well as from my organization. I did get a little bit of pushback from them for doing that. So that was another huge challenge that I'm happy to talk about more. The maternity leave policy, the policy for, taking pumping breaks throughout the clinic day, things like that was all challenges that it took a lot for me to overcome, and a lot of lessons that I learned from doing that. So 3 quick tips that I'll kind of mention right now, and then again, happy to speak more about each of these during the Q&A. But again, what I've been saying already. So number 1 is to really, really always speak up and advocate for yourself, especially when you have those very young children, because nobody else will. And I think it took me a little while to recognize that no matter how nice your administrators were or how close you may feel to your colleagues, at the end of the day, no one is going to recognize or remember or reward you for burning yourself out at work and putting your family last. And it was only you and your family that will remember how you guys suffered as a result of that. So in advocating for yourself and speaking up, you are not only helping yourself, but also paving the way for others in a similar situation. So super important. And another thing that I kind of learned that was helpful for me was to tell your patients about your kids and your family and the childcare challenges that you may face. And that if you ever have a sick child or something unexpected happen, you may have to cancel on them, that you'll do your very best to reschedule, and they can always reach out to you if they need something urgently, but there's some things that you cannot control in your schedule. With my own patient panel, who many of them are also physicians, parents of young children, and I feel like just creating that connection and trust and empathy has really helped help them understand my schedule and help us have a better relationship. And I would say the last kind of bigger picture thing that I learned is don't worry about going down to part-time or reducing your hours or doing less during this time of your life. So from, when you've heard probably by now that the time from 0 to 5 is the time when you have little kids. That is just a special time in your life where you're not going to be able to be a superstar at work. I think that there are phases in your life where you're really going to advance in your career, and there's other phases where you're just going to have to step back and focus on other things. And just recognizing that the early years of childhood is not a time when you are going to be advancing like a rock star in your career. And you just got to be okay with that, with cutting back, with putting your family first, and accepting the season of life. And I think, especially in a family if you have two working professionals as parents, one person is going to have to do that. And I think that that not only helps with burnout, but on the it actually, I guess it doesn't make you a worse physician. It actually makes you a better physician, because by limiting your hours or cutting back or whatnot, you're going to be valuing that time you spend in clinic with the patients even more, because that's the time you've devoted to being there. In the end, it's going to make you a better physician. So I think I'll stop there and pass it off to the next presenter, Dr. Chowdhury.
It seems like such a distant memory for me now, because I feel like I'm a senior career person with much older children. So as Dr. Abbott said, my name is Dr. Angela Chowdhury, and I work at Northwestern Memorial. I'm an associate professor in the Department of OBGYN. And I will say, I'm going to echo a lot of things that Jill said. I am a wife. I am a mother of 3 boys. My boys are 13, 13, and 9. I have identical twins, which was very challenging when they were very small, and has continued to be challenging, but now in different ways. I also have a husband who is also an academic subspecialist. He's an academic spine surgeon here at Northwestern as well. And so for me, parenting as a physician has been the most challenging, because we have 2 parents as physicians. And what we find is that we really do sort of alternate in our roles often to really help care for our children when they need them. I will echo Dr. Jin. When my kids were young, I took a step back. I really cut back on some of the academic work I was doing. To share, one of my sons was born with profound hearing loss at birth. And so our first 2 to 3 years of life were spent doing surgeries and going to doctor's appointments and seeing audiologists and speech therapists, and actually moving across the country for better schools and better services. And so I spent much of the early part of my parenting really parenting and not really focusing on my career. But I was really lucky. I had some amazing mentors in the people that I worked with. I asked to go part-time, and my chairman said, nope, we can cut back your hours, we can give you flexibility, and you can do all those things, and we're going to keep you on academic track. And that was a godsend. I would have been in a very different place right now had I not had that type of mentor as a chair. Similarly, once we were able to find a space and get my child where he needed to be from an education and learning standpoint, we were able to expand our family. That's when we had our youngest child. And I thought I was going to have a girl. I don't. I have 3 boys. And I really found that at that point, my parenting mode was shifting. I now understood how to take care of really young kids. But boy, the teenage years are tough. And I'm sure Dr. Abbott's going to give me great pieces of advice on this. But the way I parented was different. I think that the things that I really wanted to focus on was to say, you can do it. You can have a busy career, and you can have a busy academic career if you so choose, even as a parent. But it might not happen all right away. Years ago, I was sitting at a conference, an academic conference, and I was sitting with a senior male colleague, and he was a division chief. He was about 5 years older than me, and a division chief, and had 2 kids, and was really like running the world, been president of our major organization. And he leaned over and he said, I don't know how you guys do it. If it wasn't for my wife taking care of my kids, I wouldn't be where I am right now. And I said, I'm not where you are right now. And that's why, because I also have to take care of my kids. But guess what? It's now, fast forward 5-7 years, and I'm in a very different place. I'm able to run a service line at my hospital. I'm able to sort of have a very academic life because that's what I chose. Not everyone chooses that. Some people say they want to do something in early career, and that changes because of who they are as a parent. And that's okay too. That's all part of parenting and some of the flexibility that Jill mentioned. I think that the other thing that I really want to share is that at different times, it has to be a give and take in terms of parenting. So with both my husband and I being surgeons, we joke, but not really, that whoever's surgery day it is the one who's got to go pick the kids up from school if there's an emergency, right? So if you're in surgery, you're protected. Nobody should call you. Nobody should bother you. But if you're in the office, you might have to leave at the drop of the hat to go get your kids because there's emergencies that happen, and that's just part of it. I would say I also really, really, really rely on my amazing moms that stay home. And those are the moms that help me take care of my kids. They get them to places when I can't be there. When I'm running late to soccer practice, they're calling me and saying, I'm standing with him. Do you want me to bring him to you? It is such an important part to lean on your community because raising your children as a physician is really a team sport. It can't be an individual sport. And so I think, these are sort of what I bring, I think, to the conversation. And so I'm more than happy to take questions about navigating an academic career, multiple kids, kids with disabilities, 2-parent positions. But I'm going to stop there and I'm going to turn it over to Dr. Hopkins and let him introduce himself. Dr. Hopkins. Now, I can't see Dr. Hopkins, but he mentioned that he was back. Are you there?
I know he was having some connectivity issues, so maybe while we're waiting, I know he got back and he might have gotten booted again. So why don't I go next? So I am definitely older than you guys, and I have 2 sons. I had them during my training, the end of my residency, the last year of my residency, and the last year of my fellowship. And so to me, learning how to be a parent and learning how to be a physician were very much intertwined with each other. And I, like the 2 of you, I think it's actually fascinating and not all that common that all 3 of us ended up going part-time. But after my fellowship, I applied to 5 jobs. I got 5 jobs, but only one of them said I could work there part-time. And so I think that it's important to, and this was, a while ago, so maybe that would change, but I think that the utility to your boss may be a different priority than the personal priorities that we have. My husband's also a physician, but he's a dermatologist, and he has a lot more flexibility, especially when our kids were little. We would tag team. We tag team the nights. We tag team the days. And as someone also in academics with a variety of, expectations and requirements of me, we also would set aside days and star who was going to be the one to do backup if necessary. I think that the challenges of parenting and the challenges of physicians are very complementary skill sets. And I think that there's definitely enrichment in my children having grown up with parents who cared very much about their patients as well as their families. And I think that we've talked a lot about the balance, and I think it really speaks to sort of that complementary nature and the teamwork. I think that as an OBGYN, as an educator in OBGYN, because I've been a residency program director and I was the vice chair for education for a long time. And so having navigated when to have kids, how to have it work during training and after can be really challenging for everybody, I think. And it's something that I'll be curious to see if we get some questions or we have time to talk a little bit about that. Because I was learning how to be a parent at the same time as learning how to be a doctor, there definitely were elements of it, like even the negotiation part was, I felt like I didn't have much negotiation. Like for me, the negotiation was about my time during weekdays, and I did not negotiate any change in the call schedule. I worked full call, which I would say over time ended up being not a great idea, but at the time that I negotiated it seemed like a good idea. I was very much worried about perceptions of inequity and sore feelings and frustrations. And one of the things we're talking about is about the high rate of burnout among physicians and how to sort of carve out time for yourself. And I think that helping have equitable negotiations with your partners in terms of the work and having it sketched out in advance is really important for everybody to be able to navigate their work life and their home life and not have people who don't have kids at the time end up resenting you as a parent, or and that's important to make sure that everybody feels like they're being valued and honored in the workspace as well. I don't know if Dr. Hopkins has been able to rejoin us. I don't think so.
I'm here. Can you hear me?
Oh, you are here. Yay. All right. Passing it over to you.
Well, thank you. It's an honor to join this group today. So my family pictures are the bottom center and the upper right. My wife, Connie, and I have been married for 18 years, and we have 3 kids. Blake is 16, driving now, which is a whole different set of challenges when it comes to parenting and being a physician. Abby is 13 and knows everything, so that's good. It's always helpful to have somebody around like that. And then Cora is 11 and is just made of sugar and spice and everything nice, just like her mother. So I've been at Cleveland Clinic for almost 20 years, and I've had lots of changes throughout the course of my career. I'm a family physician. I've had lots of different administrative roles and responsibilities too, and those are things that obviously take you out of patient care, but also affect things like evening and weekend availability, and at times make it a little more challenging to get to some events for your kids. I've also seen where having more flexibility as in having an administrative role, I'm actually sometimes more able to get to my kids' events, which is very nice. That if somebody's got a game at 4:30 on a Monday afternoon, if I'm in clinic seeing patients all day, there's no way I can get to that. Whereas if I'm on administrative time in between meetings, I may have the opportunity to attend. So that's been sort of part of my experience as a physician parent. My wife, fortunately, is able to stay home with the kids. She'll always say that she's a stay-at-home mom, and my response to that is always, yeah, but you never stay home, because she's always after school or taking them somewhere. She jokes all the time that she's an uncompensated Uber driver. But now that Blake has his license, that's a little better, though. We're still looking for a car for him. If you've looked for a car lately, you'll feel my pain. So one of the things that I'll talk about as far as having a spouse who does not work in healthcare or work in medicine or work outside the home is just sort of that being the parent who's gone more of the time. And my wife over the years has had a lot more time with our kids, particularly when they were younger. And at times I'm sure she felt like she was doing a lot of the parenting alone. And at times I felt like that too, because when I would come home, I was sort of like a novelty. And kids listened to me better than they did to her, not just because I was their father, but I think because it was a different voice that they were hearing. But at times it was hard for me because I sort of felt like the JV parent, the junior varsity parent, and she was the varsity lead, because the kids would ask me something and then they would say, you know what, I better check with mom. And sometimes they were right, because I didn't know all their schedules, some of their habits, who needed to be where, when, how, and why. And at times that was a little frustrating and made me feel like I was a little less than when it came to the parenting teamwork. And we've grown up with our kids. Blake was born when I was sort of in my second year of practice, and I was driving 5 minutes each way for work. And after he was born, I thought, this is not going to work. I'm spending an hour and a half every day in the car. It's limiting the time with the kids, made it hard for me to get home in time for dinner, let alone for playtime and bath time and bedtime and all those things that are important, certainly when your kids are little. As my kids have gotten older, that's been a little different. Now they stay up later than I do, which is certainly a change of events. But I made a change in my career to work closer to home as a result of the drive time back so that I had kids and with my wife as well. And then there's just so many different unique challenges to being a physician and being a parent. Both are certainly important jobs with lots of responsibility, and certainly some liability and accountability. But when you mesh the two together, I think the effects of each are compounded. And so I'll be glad to talk about any of those issues or answer questions as we go along. But those are a few thoughts that I had about being a physician parent.
So much. So one question that I wanted to bring up that I just say something I find very interesting is how you feel that the things you've learned as a doctor have made you a better parent, and how the things that you've learned as a parent have impacted the kind of physician that you are, educator that you are, maybe organizer and, team mobilizer, if anybody wants to take that question.
I'll go first on that. Just as a family physician, I see kids and adults, and I take care of multiple generations within the same family. I definitely became a better family doctor when I had kids of my own. I think it also gave me a little bit more street cred with my patients, because when you don't have kids and you're talking about taking care of kids or medical issues specific to kids, there's a little bit of a disconnect, and people think, well, how can you really understand this if you haven't lived it? And I sort of took that personally at first, but then I sort of understood they're kind of right. I think there's also some disadvantages to kids when you have a parent who's a physician. At least in our household, I tend to be the one that downplays and discounts every complaint and symptom that they bring up. And I always live with a little bit of fear in the back of my mind that I'm going to blow off something that actually really is significant, and I'm going to downplay it and wish that I hadn't. So that's, I think, one of the fears that physician parents live with. But I do believe that it's made me a better parent as a physician, because I do know some things to watch for, and I think it's definitely made me a better physician to be a parent.
I can jump in next. I'm going to take it from a little bit of a different perspective. As an OBGYN, before I had my own children, I think I approached pregnancy and childbirth actually in a very interesting way. I was extraordinarily empathic, always worried we weren't giving enough pain medications. And I still recall being pregnant with identical twins and it being quite the challenge. But after it was all done, I actually used to tell my patients to toughen up a little bit in terms of, if I could work till 36 weeks with identical twins and I'm 5'2", so can you, right? And so we used to joke that changed a little bit how I approached my patients when I used to deliver babies. But I would say as a parent for me, I really do find that my patients definitely relate to what we're feeling. When something as simple as when I go to schedule surgery, when I see a patient in the office right now, I say, what are your summer break plans? Is it easier for me to schedule your surgery this summer while your kids are off? Or is it better when they go back to school? What's better for your schedule? And I think even those small relationships that I create with patients, even as a surgeon, make a huge difference. They in their mind are connecting. My doctor understands that I have all these other obligations. And even though this surgery is important, that's something that I have to look at. And so I think my work as a parent definitely translates into how I doctor my patients and how I approach their care.
Yeah, I completely agree with what both of you have said. I think as a general internist, I knew just enough about kids and babies and pregnancy to freak out, but not any useful information. So it was kind of the worst specialty to be in. And even now with my kids, it's like I know just enough to know the worst case scenario, but not actually what's most common. So, but I 100% agree that it's helped me relate to all of my patients, the ones with children, certainly. And I think that as an internist, we tend to, while building on my practice and whatnot, you kind of tend to attract patients in the same phase of life as you, and then you get referrals that are similar, phase in life as well. So I built up a practice of many young parents or parents of school-age children, and I think just after having kids, I was able to understand and empathize so much better. And vice versa, as I was saying before, they understand my situation better as well. I think that parenting is a great equalizer. Everybody, no matter what your job is, when your kid is sick, you're in the same situation. So I think it has helped with building a trusting relationship with many of my patients. And sometimes I feel like we're afraid to bring it up with our patients. We're afraid to let our vulnerability show as a parent. But I personally feel like it's served me well to do that in a careful way. Don't overshare, but just letting them know, you have kids, showing them a picture once in a while. Some of my patients come in and ask about my kids by name every time, which is very sweet. I have a little picture of them, hanging up in my office, and when they walk by to go to the lab, they can see it. So I think it is helpful to have that little bit of a personal connection. It's another layer of a personal connection with your patients, which I really think in this day and age of burnout and wellness and all is important to get to that personal level with your patients.
Oh, thank you guys so much. The things that I think about for me so much is what I learned about being patient, what I learned about listening, and the importance of giving my kids autonomy. I think as they got older, like I would feel that I'm an obstetrician. I only take care of pregnant people, but lots of those pregnant people are pretty young, and they're making very, very adult decisions. And certainly it's very tempting with teenagers and with, kids in college even to set down a lot of rules. But I think I felt like it really helped my kids' relationship with me, as well as my giving them responsibility from an earlier age, having the experience of being a physician in that sense. Certainly my kids knew a lot more about health and sexually transmitted diseases going to college, for example, than many might. And I remember my son saying to me, like, the RA, he texted me when he got to, the RA's door is full of condoms. You'd be so proud, And so it's nice to know that my kids have picked up some health tips from being a parent, and certainly, being an educator as well. I feel like it's really, my kids are very different from each other. And, they say when you have one great kid, you give yourself all the credit. And when you have a second kid, you realize like it has nothing to do with you at all. I don't know if that's been true for you guys, but I think that also being an educator and mentoring hundreds of students over the years, having the grace to allow people their variations and how they approach different things, and seeing the opportunities that everybody has to learn about themselves and to develop their own capacity for learning and direction. I felt like that helps me. And of course, I'm talking about older kids than you guys have, but I do think that it helped a lot. For me, I think it, as we were talking about, sort of it adds that richness to life. I mean, one of the things that I was curious for you guys, because for me, when my kids were growing up, was a time that I became caretaker for my parents and then for my in-laws. And a lot of the things that you're talking about, Jill, about, letting your patients know what's going on and letting your colleagues know what's going on with your family and asking for flexibility when necessary, I also found to be really true at a time in my career when I felt much more comfortable having that vulnerability, because when I was young, I felt like I had to be the tough new one, even though I also had little kids at the time. And I guess I'm curious for you guys during COVID, if you were able to benefit from multi-generations in terms of parenting, or whether that was part of the stress of not being able to be with family and how that affected your kids. I don't know if anybody could talk a little bit about that.
I can hop in, Jody. I'll say during COVID, we were very, very isolated. My parents are in their 80s and live about 6 hours away. And we felt really isolated during that time, not being able to see my parents at their age, not getting together for holidays. And so we did not have a lot of help during COVID. We were lucky during COVID that my kids were just hitting the age where they could start to really begin to watch themselves a little bit more. And we had a little bit more flexibility. I had to give them some automatic autonomy that said, you're going to be on school and you're not going to be watching YouTube videos, and I have to go to work. And that sort of autonomy, I think, has helped my children grow a little bit. But from the multi-generational standpoint, I'm kind of living, I think, what you probably went through, Jody, where I am really finding I'm in a caregiving situation for my parents in their 80s and my mother-in-law. And with that, we are stretched really thin. Now, all of a sudden, rather than just caring for our kids who've just started to learn to care for themselves, we're also really needing to care for our parents. And that might be driving to doctor's appointments and making sure they're taken care of and making sure their house is taken care of. And so I think that brings a whole nother nuance as you go through your career as a physician, because we are at heart caregivers, right? And so in general, our families often too look to us as the caregivers for them. And so I think it's something we always have to remember to also take care of ourselves, because sometimes that really gets lost in the variety of caregiving that we do.
Well, I don't have too much to add to that. In terms of what we did during COVID, yeah, same. We did not rely on our parents, which was the first time since my kids were born that we did not have a stable source of childcare from the grandparents, and that was taken away, and that was very, very stressful. We had to find a nanny in a week, basically, when everything shut down, which we did. We found a fantastic nanny who saved our lives. She's the reason that, my husband, who is also a physician and was going to work all through COVID, she's the reason we are still alive today. But yes, it did. I think that it really made us appreciate having had grandparents around to help with the kids a lot more. And it's an interesting point, Jody, because I think that we are just starting to think about that transition just now, as our parents are in their late 60s, early 70s now. And my husband is an only child, and I have a younger sister, but she does not live in this country. So it's really just us, who will have to someday be the primary caretakers for our parents. So I kind of never really appreciated that transition that kind of happens, as you were saying, Angela, just as your kids are starting to get self-sufficient, you transition to that caregiving role for our parents. But it's what we're trained to do, I guess. And Jody, I saw a question in the chat, if you don't mind me turning it over to you. I think this is for you, so I kind of wanted to pose it to you. You were just talking about kind of feeling isolated during the pandemic, but this is about feeling isolated. Or did you feel isolated as a new parent during residency or as an attending physician, or was there support of parent residents?
That would be exactly the nail on the head. I would say there was absolutely zero support. I was a resident in a city, Boston now, where I've lived for a long time, but I was still pretty new to it. I only knew people who were other resident physicians in OBGYN. And so I had zero support. And I don't know how much we're going to get a chance to talk about caretaker leave, but at the time I was told by my chair, I had matched in a fellowship already, that if I took one day more than 6 weeks, during my residency, I would have to repeat my chief year and I wouldn't be able to start fellowship. So I was petrified throughout my pregnancy that I would end up having a health condition because, of course, you know, as we've alluded to a little bit, you know all the bad stuff. Like we know all the bad stuff very well. And I did get in a car accident post-call after a 36-hour shift while pregnant and went into premature labor and ended up, and this is an example, I would say, of physicians having poor judgment about their own health. We set up a clinic for me where I sat in the room and I didn't get up. They brought all the patients into me and I just, you know, it was just a follow-up prenatal clinic, but I wanted to go back to work so I wouldn't have to lose my 6 weeks after the baby was born. And so there have been a number of attempted changes to the system over time. And I think that's one of the reasons that I really work hard now to try to advocate for physician pregnancies, moms, and timing, because it's really important, I think, to again, to set up the kind of resources and also just to model different kinds of parenting situations. And we've chosen to work part-time, but not everybody does. And I've known a number of moms who have, who are lucky enough, as Kevin is, to have a caretaker at home, have dad be at home, and then to continue to navigate their work life as physician moms. So there's all kinds of different models. And I think that it helps our trainees the most just to see lots of different ways to be a physician parent, lots of different opportunities, full-time and part-time and academic and private. But yeah, I pretty much had no zero support. And it became very different when I had my second child because one of the co-residents had a baby and she knew other people in the neighborhood. And then all of a sudden you have a neighborhood. And I think it's pretty common that once you have more than one child, you already, you know, other kids because your kids have friends. And so you have a little bit more of a network, you know, that mom network that Angela was talking about, you know, those people. And I have not been in a situation where I worked at a place that had daycare in the building, but I certainly have worked at many places that the organizations have worked very hard to set up a safety net, a childcare safety net of availability, even if it's not what people choose to do. But I wonder if things were really any different for you, Angela, when you had your kids. Did you have a support group when you first had those babies?
Yeah, no, I was living in Salt Lake City, Utah. It was my first real job, and we literally just got married and moved there. And you know, I was really lucky. I think that I had an amazing group of colleagues that were a little older than me that had children already. But you are a little bit on an island, and you know, as far from family when my kids were first born, and that was in the time there was no such thing as night nannies in Salt Lake City. I know that's a thing in major cities now that all my friends did here in Chicago, but that wasn't a thing that we had, and it was hard. It's hard to find those people to be with. And I would just add to everything Jody said is that it feels very, very isolating. I saw another question come in through the chat talking about being a single mom, thinking about residency. And I would say that the first thing that you can really do when you start to really navigate parenthood and doctoring at the same time, especially training, is really communicate with the people you're working with. Let them know what you need, right? If you don't let them know, it always seems as though you're asking. And like Jody was mentioning, this idea of equity, we all want it to be equal. When I went part-time, I too took full-time call because, you know, it just felt like the right thing for my colleagues. Whether that was the right thing is neither here nor there. But similarly for, you know, a new parent going into training or a single parent, I would say, find out what resources there are. Is there a childcare nearby? What are my hours going to look like? Can I get coverage if I have to run out to get my child? How am I going to manage that? Obviously, hopefully not a frequent occurrence, but when those occurrences happen, it's really nice to know that there's a supportive network around you. And I think that's when you look at residency programs and look at training programs and talk to program directors, it's really important to really better understand what those support structures are within your program that can really help you get through those really hard times. So hopefully that's helpful.
I think one of the things that gives me the most hope is just hearing, Jill, about your willingness to advocate for yourself, because that's something that I felt very uncomfortable doing as the most junior person on the team and the newest parent. I felt like, my job was kind of to be quiet and take care of things. And I think that was a lot of how we did things back in those days. It was very much, I literally have been in programs where groups of people would decide that our motto would be no whining. And I think that when you do that, the purpose of it is a very much this shared community of suffering, and struggle. And I think that has tremendous implications over years and years, and really does wear us down. And it also means that we aren't comfortable sharing our vulnerabilities with our team, because then you feel like, oh, that's right, I can't say how, I've had 2 kids with a cold and no one slept in the house for 2 weeks. And, I've been picking up all, doing laundry all the time, and I'm exhausted, and all we're doing is living on pizza and macaroni. And, I think that inability to identify your own vulnerabilities and your own needs, I think is ultimately really unhealthy. And I hope that we'll be able to move forward, because, part of what we want to do is to create this medical practice of community of culture where we're all able to self-advocate for our wellness. And that means to advocate for our vulnerabilities and our needs. And, when your kids grow up, you realize, like, oh yeah, that was the period of life of when my kids were little, and I'm not in that anymore. But at the time, it's so all consuming, it's hard to keep that perspective. One of the things I wanted to talk about is what healthcare organizations are doing to make this less difficult or onerous. And so I didn't know if you guys want to share the places where you guys are in your departments, in your practices, and maybe in your organization.
Yeah, I can speak a little bit about that. And I think, Jody, I do think you hit the nail on the head. Again, I feel like we're kind of being a broken record, but yes, we are really trained not to speak up ever. When we are training, as residents, it's kind of, you have to go through the suffering like everybody else did. And it did, I think, it really took COVID to push many people, myself included, to the breaking point where that was no longer sustainable. And in terms of getting the organization's attention, or this is the moment with COVID, everything that physicians and the healthcare workforce has gone through. Now is when people are listening. The organizations, the leadership, they are listening to our concerns, and they are seeing that burnout is the single biggest crisis that healthcare organizations have faced ever. And with that, there are lots of changes that need to happen from the systemic level. I think that bringing, things such as maternity leave, vacation coverage, sick leave for yourself and your kids, all that should be brought into the conversation. Just remind, these, again, all issues that predated COVID that we've been working on, I think, for decades. I think our maternity leave policy has made very minimal progress since, 20 years ago, but it's still, now is the time to bring it up again and again. I would say that is another one of the lessons I've learned is, if you ask for something and you get a no, ask again, to a different person, or wait a few months, or bring it up again and again. There are things that it took me many times of sending the same email to different people to finally find a solution. So don't be afraid to circle back on things if you hear a no the first time around. And again, capitalize on any, if wellness is a focus right now, or if there is a specific leader or administrator who really gets it, who understands, who you feel like is a trustworthy person, capitalize on that, bring it up to them. And again, kind of don't be afraid to speak out. I think a fear of many early career physicians or physician parents is being not liked, or judged or perceived as needy, but that's okay. I mean, they're not going to fire you for asking their things, right? They may think that, you're kind of, you're someone who is very persistent or whatnot. And yeah, maybe you won't be less liked by some people, but I think again, at the end of the day, that doesn't matter. What matters is your family, your relationship to your patients, and your own well-being.
I'll just add to that I think, when you're looking either at training programs or jobs, I think everyone wants this perfect picture, this amazing maternity leave, childcare on site, the best partners, the best team, the best education. And I think the thing to remember is that every organization is a work in progress, right? They are working on things bit by bit. So there actually was a maternity leave policy change at our institution 5 to 7 years ago, Dr. Chit, I was a part of it, so it's a little bit better now. And but it's still not perfect, right? There's still room to improve. And so I always say from an organizational standpoint, I really think, looking at wellness as a whole and looking at parenting in particular, even if we can begin to sort of knock down the barriers to parenting well as a physician and doctoring well as a parent, I think it's really important to recognize that not any place is going to be perfect, but if there's a dedication to really improving the lives of physician parents, that's going to come out in some of the discussions you have, whether that's your community support system, maybe it's the maternity leave policy, maybe it's the childcare, maybe it's the sick leave, maybe it's the ability to have more flexibility in your schedule. I know, Dr. Jen, you started off this conversation talking about flexibility, and I tell people often that's probably the one thing that's most important to me in my job, is that if I need to leave at 2 p.m., that I can let my office know and say, please apologize to my patients, let them know my child had an emergency, I have to go. And that ability to do that and work in an organization with administrative leaders who allow me to do that is one of the most important things to me as a physician parent. And so asking those questions, and you don't need to be a pain to do it. You don't need to be labeled that person who's always needy. It's instead you're voicing your concerns, because those are both two really important jobs, like Dr. Abbott said, and we have to do a really good job at working at both of them.
I have operational oversight of all of our ambulatory primary care practices in Cleveland, and my response is pretty much always the same. I don't want to work with somebody whose family isn't a higher priority than their job. So yeah, when you need to leave because you've got a sick kid, that's what you should do. If something else is possible to get them taken care of or from here to there, then that's great if you're able to do that. But if you have to leave because of a family emergency or an urgent situation or whatever it is, whether it's your child, your elderly parent, or whomever, I don't want to hire somebody whose family isn't the top priority. We're all here to do a job. Everybody that I know works hard and isn't afraid of hard work. And yet we also have other roles and responsibilities throughout our life that in many respects are way more important than a lot of the work that we do every day. For most of my career, I have not taken care of myself from a physical standpoint. I've put my own health on the back burner, whether it's physical, mental, emotional, spiritual. And I came to the realization that I've got to decide, am I willing to trade my own life and potentially my family for my career or for my job? I'm not. And so, I would just encourage everybody to ask themselves that question. Are you willing to trade your own life or your family for your career or your job? And then however you answer that question, act accordingly every day and let that help you set boundaries and be your guiding light for every day. There's more work to do than any of us can possibly do in the time that we're allotted for doing it. And so if we allow it to be all consuming, it will. And I don't want my work to define me. When I meet people for the first time, I'm more interested in talking about my family, my kids, my hobbies and interests. And if they find out I'm a doctor, that's okay too, but that's certainly not what I lead with. I don't want that to be my identity. I don't want it to be the thing that I'm remembered for.
Thank you. There's two great points that got brought up in the Q&A that I wanted to bring out. One of them was about, sometimes it's not when your kids are little that they need extra time. Sometimes it's when they're older. And how do you navigate if you have to step back clinically? And one thing I wanted to say is in the past 2 years, there's been more than a half dozen of people in my relatively small department who have taken FMLA because of urgency in the care of their family members, and some it was their children, and some it was parents, and again, I think that comes back to some organizational will and a community that treats each other like, I'm going to prioritize my family, and I want you to prioritize your family, and when you need that time, you have it. I wondered if others of you have seen departments that are successfully able to do that, and how you think that can work for people who come back after a period of time away.
That's a hard question, Jody. I would say, in our department, I think you being an OB/GYN also probably feel similarly. In our world, it's tough. Being proceduralist, I think being able to come back does require some form of reinstatement and getting skill levels back up to where they need to be. We work really hard at that in our department for people who do need to take a leave, and sort of create sort of shadowing programs and observation programs for them as they're sort of ramping back up into their schedules. But I think on a more sort of larger national level, I think that's a really big question. And I think it probably varies between some of the procedural subspecialties and some of the medical subspecialties. So I'd love to hear from Dr. Hopkins or Dr. Jin if they have thoughts from a medical standpoint.
In our organization, far more common is people reducing their FTE rather than taking long chunks of time off. And it's a common trend anyway, due to caregiver burnout issues, and I always kind of feel sad when I see that happen, because what it means is that person's really not working fewer hours. They've just decided to take a 10% or 20% pay cut because they can't get all of their work done in the amount of time allotted for it, and so they become a part-time volunteer. But we have lots of examples where that's really common now. 20 years ago, that wasn't common. It was full-time or maybe half-time or zero time. And now we have people with an FTE that range from 0.4 to 1.0 and everything in between. There are more and more part-time physicians and other providers now than probably there have ever been. And it allows people greater flexibility in their schedule, especially at times where your family needs you more and more. And your point, Jody, about sometimes your kids need you more when they're older is a really good one for me. I have sort of a fear of missing out on crucial conversations with my kids because I just wasn't there at the time. Or, the conversation I had with my son when he was probably 12 about the birds and the bees was on vacation. I took him out on a sailboat. It was just the two of us, and he couldn't get away from me, so he had to listen to me. But that's part of parenting, and those are crucial times, and we don't want to miss out on those or miss it.
Yeah, I think that in terms of how organizations can address this, I do think, Kevin, I agree that the option to reduce FTE or to start out at a lower FTE when joining a practice is essential. And I think that's still something many organizations are working to wrap their minds around. As I mentioned, I did get a lot of resistance from cutting down my FTE after having kids, and in part because that was when I started my work with the AMA, and that's what allowed it to work out. I think that if I had just simply wanted to reduce my FTE because I had kids, it would have been even more difficult. But I think if kind of organizations can change their perspective to see that this is a well-being issue, and by allowing parents to do that, they will reduce, the turnover, and because of the fact that they will be less burnt out, their patient care will still, will be potentially improved, and that they'll eventually, when, either when their kids get older or maybe when they get more help or whatnot, they may increase their FTE later on. So I think it is right now, I think a lot of organizations are saying, let's start them at the full time, 36 hours of patient facing time per week, which is just not sustainable for anyone, parent or otherwise. But let's get them to the point of burnout and then see if they need to cut down. But I think if, organizations can shift to saying, oh, maybe we can give them the option. Let's say, do you want to start at 28 hours? Do you want to start instead at even less than that, giving the option to start out at less and offer that built-in flexibility instead of having these physicians get to the point of burnout and being forced to cut down because that's the only thing they can do. I think that would be something that can be helpful.
Thank you. I think those are all really great points. There's another question in the chat about how do you find a family-friendly residency? And what I usually say to people is the question to ask is, how does your residency handle it when people get pregnant? And how does that class get along with each other? Because I have seen, as I'm sure you guys have seen as well, situations where a child really has like almost 4 co-parents, and that, that class is so strong and that they all feel so bonded to that baby that one person birthed and everybody feels like an auntie too. And so in that way, it's really enriching and beautiful. And I think that, and then other times where it hasn't worked out with as much collegiality. So I think that asking that question in residency interviews can help you understand a lot about whether there's enough flexibility in that program for that person to have taken the time that they need to be a parent, and for their classmates to still be able to share in their appreciation, as well as the kind of bond that they have. I don't know if there's other comments that you guys would have or other tips, because we're winding down now. I didn't know if anybody had a quick anecdote, just something funny that your kids have said or observed about having a physician parent. I think there's some hilarious things that happen at times. And I remember my son in first grade saying to one of his classmates, they let boys be doctors too, it's not only girls. I thought, isn't that nice? What about you guys? Anything for us to end on about how our kids' lives have been enriched by us as physicians?
I'll add to this one. So my now 13-year-old son, a few years ago, didn't realize I'd stopped doing obstetrics about 5 years before. He grew up with me doing night shifts and night calls, weeks of call at a time. And I was chatting with him and he said, "Yeah, Mom, are you going in to deliver a baby today?" And I said, "No, sweetheart, I stopped delivering babies a few years ago." And he said, "Really, Mom? Why?" And I was like, "Well, remember, I used to be gone. I didn't see you. I was working all the time. It'd be a week at a time, and I didn't ever get to have dinner with you." And he said, "No, Mom, I didn't remember any of that. I just remembered that it was really cool that you deliver babies, and I used to tell all my friends." And I was like, oh, that's what he remembers, and that was what was most important to him. So no resenting me for not being there, just sort of the joy of what a cool job Mom has.
Thank you all so much for joining us, and thanks to all of you for being here. I think it's been such an enriching conversation, and it helps us recognize the shared goals that we all have to be the kind of doctors who care about our families as much as our patients, and are able to realize our purpose in medicine as well as our purpose in life. See you all another time. Thanks to Steps Forward. Thanks to Dr. Jin, Dr. Chowdhury, and Dr. Hopkins. Have a great day, everybody.